Good afternoon and welcome to the Van Dyke Mortgage Center here for a great presentation about our medical debt here in Muskegon. And I think it'll apply pretty much anywhere else around the world too that you may be watching. We are here today at the Van Dyke Mortgage Center downstairs in the Transnation Title Room. This is going to go on until 6 o'clock this afternoon. You'll see it streamed on Muskegon channel through Positively Muskegon, and this is also being recorded for those who cannot make it here today. But if you are watching, you're welcome. This is a great way to blow off the last 2 hours of your workday. So congratulations on that, and that's our public service for today, giving you the last 2 hours off of work. But we do go till 6, so please, if you are watching, stop down and meet some of the people that are helping put this great event on today, which is all about medical debt. Let's face it, it's something that could either be discussed in a way that, oh, that's just terrible irresponsibility of people who are, using the medical system wrong and all this other kind of stuff. Or we could look at the reality of things and say it's not hard to get in a car accident or have a heart attack or a stroke or anything like that. And before you know it, anybody could really be facing a major problem with medical problems, right? And debt. It's something that we all have to face. Myself, I woke up today and I am remarkably well insured through my wife, which, thank God, right? She makes up everything for me. But we've got great insurance, but we do have that beginning of the year, you got to meet your deductible, right? I woke up today to over $1,000 in deductibles in my email that have to be met today. That's a lot of money to anybody. I mean, and to think of those who don't have the income or the ability to go out and generate that income over a couple of months, they're facing a big problem right now. In fact, what is it, $400 that most people can't afford an emergency for anywhere in the United States? That's a tough reality to face. And when you're looking at something, like say last year I had to go to the Mayo Clinic for a procedure. I literally got the bill for that after my insurance took care of it, and I thought, I wouldn't put that much money into a used car like me for anything. It's a lot of money, and it's funny, right? But it's true. You have to start making those decisions, and that is just really not what healthcare in the United States should be. We should not have to stop and think, am I worth having this gland taken out at the Mayo Clinic because I might not be able to afford that. We can do better, and that's what today is all about. So we are going to get things turned over to a couple of our first speakers that are going to kind of walk us into what we are here today, and they are Vondi Woodbury and Miranda Fowler. They've got a little presentation about how they've got here today. After that, we are going to hear from the good folks from the Medical Debt Company. So Vondi and Miranda, come on up. And we're looking forward to hearing from these guys a little bit more. Make them feel welcome here at the Van Dyke Mortgage Center.
We have stairs over here. Hello and welcome today. Can everyone hear me? How are we good back there? Okay. I'm not sure who thought it was a good idea to give me a mic, but they did, so bear with me here. First of all, I want to thank everyone for being here, our partners who have agreed to come here today and share their organization and what they're doing today, and especially a big thanks to RIP, coming all the way in from New York to come here and speak to you today. So let's give them a round of applause for being here today. So Access Health was created 25 years ago out of a need for affordable health coverage, and while that need is still there, and the... Is that better? Okay, thank you. Okay, and so while that need is still there, the reason for the need has changed slightly. So now we see that it's a cost barrier for high deductibles, high copays, and it's really becoming really unaffordable. Right now, it is estimated that 18% of local residents have medical debt in collections. And in 2022, during the Livability Lab 3.0, thank you, Sam. I keep looking to Sam to make sure I get my dates right there, but in 2022, the Medical Debt Action Team, the first medical team, was formed. And with that team, what we really wanted to look at is understand what type of medical debt was happening in Muskegon County. What we found is people were really reluctant to talk about their medical debt, whether or not that be shame, that be stigma. And so we really want to dive into this a second year and really kind of really understand why people, or what's happening. And so in 2023, we launched our second medical debt action team, where we had 3 focuses. One of them being we wanted to do an environmental scan to see what kind of information is even in the community regarding literature on education, how to understand your deductibles, what it means to choose a health plan. Second to that, we wanted to do this community forum, which is what we're here today for. And lastly, what we wanted to do is we wanted to, I'm sorry, I lost my notes here. We wanted to host focus groups. So last September, August, we held 5 different focus groups. You know, I have slides here. So I am so sorry. Like I said, I don't know who thought it was a good idea to give me a mic, but someone did. So year 1, again, shame. Year 2, the environmental scan, the focus groups, and reaching out to different interest groups. So working out with the hospital systems to see what kind of information is out there in terms of the charitable care assistance programs that they have, and then really coming together for this forum. We did partner, like I said early on, we partnered with RIP Medical Debt. This partnership came back in 2022, where RIP, and they will speak to this much more gracefully than I can, but RIP, what they do is they absolve medical debt within communities across the country in a much more eloquent way than that. And Eva will speak to that. But really what happened in 2022 is RIP said, you know what, let's really understand what's happening in these communities. So it's great that they come in and they absolve the debt, but what happens next? That debt is going to accumulate again. So RIP partnered with Access Health here in Muskegon, Michigan, as well as a community in Ohio. Did I get that right this time? Illinois. I keep going for Ohio. But in 2022, RIP, in partnership with our local health system, was able to abolish $25 million worth of medical debt across just this medical catchment area, much more across the state of Michigan. The 5 focus groups that we held back in 2023 were a combination of business professionals, CBOs, so local community organizations, senior citizens, community health workers, and local residents. And some of the things that we found within that is the lack of knowledge of the resources that are available. So often we heard, well, we didn't know about that program, that they did charitable care like Volunteer for Dental. And so just the lack of awareness of those programs in our own community. Also, some of the personal experiences that they shared where, you know, they had to choose between either paying for their medications or getting their food. And so often they were put in positions where they had to make those difficult choices. And so with that, before I bring Vondi on, something I've been kind of saying over and over again, and I probably sound like a broken record to many people in my organization, but medical debt is really affecting a lot of different people across a lot of different areas. It's no longer, you know, well, I will say that it does affect certain demographics, of course, more than others, but medical debt is really there affecting everyone across the entire country. And so today I would love us to start having those conversations and those difficult conversations and just talking about what's causing that medical debt and have some open and honest conversations. I'm gonna bring Vondi up here to kind of talk about where we're at now. Vondi? All right.
Thank you, Miranda. Let's see. So, oh, I'm clicking it, right?
Oh, yes.
Oh.
I mean, I did it, so you can choose to.
Okay. So my daughter's had some medical issues, and we weren't very happy with she's in Washington, D.C. She's not here. And so we decided, I said to her, we're not getting the best of care. I think we need to go out of network. And she said to me, what is that? I think that, you know, that spoke a whole lot to me because I have spent better part of my life working in healthcare, and for her not to know what out of network means said something in terms of how we communicate and how we help people understand what the issues are when it comes to things like medical debt. How do we get ourselves into trouble? Because we know this is totally different than the kinds of other debt that we have. It's not about going out and shopping. It's not about going to some wonderful place to lay under a palm tree. This is stuff that happens. It happens to all of us at some point that we get sick or we have an injury. And so our understanding of how a system works is just fundamental if we're going to be able to deal with something like medical debt. So as Miranda said, we did 5 focus groups, and we found that there were certain themes that sort of were recurring as we were going through those conversations. If you've ever been in a focus group, you bring up a group of people together and basically ask them a series of questions and just get their response and listen to what they're saying about what their life experience is. So the first one that we wanted to kind of focus in on was the state of well-being. We said to them, so how are things in your life right now, or how are things with the people that you know? And so these were some of the things that kept coming up. And I think what was interesting with this was the number of people who said people are taking second jobs because they can't make it in this economy. And whether they're young or they're old, they are taking those second jobs. And of course, we hear a lot about how many people now are in the workforce, but we don't ask why are they in the workforce, right? So as you'll see on the slides, there are a couple groups there that really stuck out for I know for me and for others because of the cost of living. The first is that families with kids, especially young families, when they enter the workforce, they're not making the same amount of money as somebody who's been there maybe 20 years, right? So they go in at a lower level of salary, and then when they go to, get their medical care, they sign on for their medical benefits, they're left with a whole lot less money to spend than are people who have been in a position for a number of years. And then with seniors, we said, oh, Medicare's got it all. I'm on Medicare. Anybody else in here on Medicare? There's a few oldies. Yeah. So you may have heard of Medicare Advantage. So that's new, right? It's sort of a privatized way of dealing with Medicare. Well, what they do is they actually give you copays. And some of those copays and deductibles, again, are very, very high, something many of us were not prepared for in terms of how we structured our retirements. So those are, as you look at different sectors who are affected in the community, that's what really stood out. So those salaries, people need help. I think you all know that. We all talk about the fact there's not enough food or housing or things for people. Housing is really dreadful right now in terms of trying to get people emergency housing. It came up that community resources aren't equally distributed. We have a mindset that people who live in certain areas have everything they need. That's not necessarily true. Many people are struggling throughout our community, rural areas, urban areas, even in the suburbs. So, and then another piece that came up was information about resources. And that was a challenge for us as a group as we began to put this together, because how do we get word out? We used to, I think, lean into the Chronicle. You'd see these things, they pop up, I want to go to that. We don't have that anymore, and we've tried to use social media as much as possible, but not everybody has access to social media. And one of the issues that came up is that senior citizens, they may have smartphones, but they can't read them because the type is so small, right? And so if they're going to go in and they're going to try to find things, it's really difficult. So I think one of the things, part of what we've taken away from this process is learning that, there are no simple solutions in terms of the things that people are dealing with today. So and before I move on, behavioral health. Behavioral health came up a lot about what happens when people, the suicide prevention kinds of things, what happens if a child is getting bullied in school, what happens if you have someone who has serious mental health disorders and has to be hospitalized against their will. There were areas there that also popped out in terms of people getting medical debt because it's unexpected, it's immediate, it's emergency, and then with people who have substance use disorders, the issue there was most of the services they needed were not available in our community, and so they've had to go somewhere else, and that costs money for families as well. Okay, coverage and costs. So we asked them about healthcare coverage and costs, which of course you need to do if you're going to talk about medical debt. And so, and by the way, some of these highlighted things, do I fill my prescriptions this month or do I eat? That came up. Another one that I don't know as we included in this slideshow was, well, I've gotten a terrible, I know I've got something terrible going on with me, but I'm not going to go and take care of it. I'm not going to pay for that cancer care because I don't want to leave my spouse in debt. There's some amazing quotes that we got out of these groups. They were so compelling, heartbreaking. So anyway, everybody in our group, or not everybody, but there were a good number of people in our group who had been medically uninsured as a portion of their lives. And there were multiple reasons that people raised that people don't have coverage, with cost being a factor. And the cost wasn't that, you couldn't afford to get a premium. The cost was the back end stuff. It was the deductibles, the co-pays, all of those things that seem hidden for most of us as folks who are, consumers of healthcare. So those trending issues, again, cost, the billing process is really confusing for a lot of people. Billing comes out, and they come out from different sectors. A specialist sends you a bill, somebody else sends you a bill, and they arrive at different times, and it's really confusing for a lot of people to figure out what to do about that and how to manage those bills. The health system scheduling is also, healthcare has changed for old people like me and those few people over there. When we got sick as kids or as adults, you called your doctor, you went right in to see them. Well, the scheduling right now has changed immensely in terms of, can you get at a primary care physician when you want to see one? And the answer is no, because the way that the system is structured now, those physicians have scheduled out 6 months. And that came up a lot too, that people said, I put it off, I didn't go, or I hit urgent care, or I hit the emergency room. So we found that people who were eligible for Medicaid did not want to take it because of the stigma. And with Medicare, I've mentioned the Advantage plans already, but one other thing about how insurance is structured, right? I mean, we hear a lot about, we have these choices. We have all of these choices in terms of knowing who's going to charge you what. But the reality is, for all of us, is once we're in an insurance plan, we have a certain group of physicians that we can use, and sometimes the physician that you want to use is not part of that network. Next one. So most people who go in the hospital are terrified about the bill. And so medical debt, again, everybody agreed in our focus groups that medical debt is a serious problem. And the result of it is that we have a lot of people who avoid care. They should be going in, they should be seeing a physician, they should go in, and they put it off. The cost isn't transparent. You don't know what you're going to get when you go in and what that bill is going to look like. Insurance locks you, again, into that network, so that makes it difficult for you to make choices that are based upon cost, right? There's an inability to save money. We heard from people, they're taking the premium out of my salary, and then I've got to think about my pension because I've got to self-fund a pension, and then I've got a medical savings account. Well, there's nothing left for the medical savings account. And somebody said, how do you really plan for a broken leg? How do you put money away for that? Good point, and something for all of us to think about. So affordability, co-pays, the trade-offs with household budgets. We had people who said, rather than doing the health care, we got to have food. We got to pay rent. And then, of course, if there's issues when insurance denies care or you're using an out-of-network provider, and you'll hear a story about that a little later. Next. So most people who go to the hospital, again, are terrified. What happens? How does medical debt impact life? It can ruin a marriage. That one came up. Destroys your credit, impossible to get credit. We had someone who said, I can't get credit at all. I just can't. It's not going to happen for the rest of my life. You're unable to purchase a car or a home, again, because of the credit situation. Unable to live a normal life. People carry that stress with them. The anxiety, all that bills have to do. We all carry bills, and some of us, these are the kind of bills that come at you in a flash, and you're not prepared for them. Next, personal experience. So these were some of the examples that people raised. Again, the behavioral health, kids with developmental disabilities who had some medical issues, parents with severe mental illness, family with multiple medical bills. There was one where both a child and a husband both got sick within the same month, both had to go to hospitals. They went to separate hospitals, and they got all kinds of bills. So chronic disease management, obviously, there's plenty of that around, and if the primary breadwinner, passes away. We had one individual whose husband had died. She was within 5 years of Medicare, decided not to pick up any insurance, and of course got sick. Job loss, insurance denies care, and again, the out-of-network piece. So as next one, 2 more. So final thoughts. People said, the system is broken. Many people feel the system is broken, and they feel that stress. Locating resources, we heard over and over again, and Miranda mentioned it, people don't know the resources that we have in the community anymore. They don't know what's there, they don't know what's available. That's one of the reasons we had all these booths. It's sort of like, you need to know that there are people here who are able to help you. Income levels are not meeting needs in terms of cost of living, and I think that's something we're all kind of aware of too. You can make more in Grand Rapids, but that doesn't mean you want to live in Grand Rapids. It really does get tough. We've got a good number of people here who are struggling financially. Obviously, information on rights, and we've got some information back there for all of you. Please take some when you go. And we, again, want to thank, there were 2 people who had received debt assistance from RIP Medical Debt, and that was, thank you, RIP, wherever you are. So thank you, RIP. You know, they talked about the impact that their anxiety was gone. They had additional money for their family budget. So we know that this has an impact if we're able to pay those bills. I think, Miranda, you were going to do these? Do you want to take this one? This is the last one? Sure. Okay. Next step, conversations. So as Miranda talked, we have, you know, a debt group that we've been looking at this now for 2 years as part of Livability Lab. If you're interested in getting involved, please, you know, let us know. We'd love to have some more members. These are the kinds of grassroots strategies that really can build momentum and change things if we all work together. There's some significant policy changes that we could look at, and RIP will be talking about that here in a bit. And other issues things that we can do locally to really reduce barriers so that people, again, know their rights, know what they can do, know about financial assistance at the hospital, know how to look at an insurance policy and make a decision, have employers look at them and understand that when they sign up for a certain health plan for their members, for their employees, what that's going to mean. So there's much to do, and we need many more people at the table. So please, you know, talk to us afterwards. We'd love to have you get involved. Thank you.
I know we're crunching for time a little bit, but thank you, Vondi, for a very great presentation there and a lot of information. Our keynote speaker will be here for RIP Medical Debt, but I'd like to, if I may, just for a minute, I'd like to add a couple of thoughts from my line of work of what we see. I broadcast. I'm the media. I'm the people you're not hearing enough from. And you know, I know you make a face, Laura, and thank you. But that's a very big reality that we face here. And it's not just us. It's all smaller markets like this that do not have adequate media to cover what they are doing. And it is very difficult. It is a remarkably hard upstream swim to get enough information out to 161,000 people in this county that don't understand. They feel alone. They feel left out. They feel forgotten. And that is in every municipality in this county. It's no different in Holton than it is in Muskegon Heights. Absolutely no different. And that's our lack of media. That's where we've been left. The second thing I heard brought up was that people were embarrassed to talk about their medical debt. This is a problem for us that has been here for decades. We have been put into, so let me give you this quick little story. I will do a career day on media to 8th graders and above. And when I speak to 8th graders and above, I ask them what they hear and see about our community on the news. 19 out of 20 years, I have gotten one answer from a group of 8th graders, and that is somebody has gotten shot. We have been pigeonholed to a place where we don't even dare talk about what we need to fix our own lives. We've been shamed into that corner, and we can no longer tolerate that. We are valuable. We are good people. We are people who deserve the same things everybody else gets. And to be ashamed of saying I need help with medical debt because I got cancer or my kid got sick, that is a mindset that has to change. And we have to do that together. So don't be ashamed of who you are or where you're from anymore. This is our community, and we're building it together. And it's an uphill swim. This is a long problem. I mean, if you ask an 8th grader what their community means to them, and all they can come up with is murder, we've already lost our generation in the 8th grade, and they're out of here. So that's a systemic problem that we have to look at. Keynote speaker, wow, look at that, 3:30, how far are we off? Greg Brody and Eva Stahl are our next. Come on up. Greg and Eva, thank you for being here today. And they're going to talk from RIP medical debt. We've got steps over here if you want. Look at her go. Wow. Oh, perfect. Make them feel welcome here in Muskegon. Thank you.
I was like, we're just on time. We're right on time. Hi, everyone. My name's Eva Stahl. I'm with RIP Medical Debt. I'm with my colleague, Gregory, who's standing in the back, taking a picture, which is lovely. Okay, so I'm going to start by just telling you a little bit about who RIP is so that you know kind of what we do, because it's a little bit wild. And then I'm going to walk you through a little bit about medical debt so that you can see what Vondi was just talking about, how this is not just unique to Muskegon or Michigan. This is everywhere. We're going to talk a little bit about that. And then how it's really, this conversation is kicking up in a way that we are in a moment. And so there's a lot to be done at the federal level that's moving that I can tell you about. And then some things that are happening across states, and really to sort of set the stage for a conversation about what can you do in your own community and what can you do in your own state. So with that, I will tell you a little bit about this nonprofit, this little nonprofit that we have that has grown tremendously over the past couple of years in particular. We are a charitable organization that takes philanthropic funds, so donated dollars, and we buy medical debt in bulk. And we buy it for pennies on the dollar because that's how the debt market works. When bills have gone through the whole process of collection, they're not worth very much to the holder, which is usually the provider, right, or the hospital system, and they usually write that off as bad debt. So we offer to buy that bad debt. So if you give me $1, I can abolish and get rid of $100 of medical debt. So with that model, which is the debt model, the debt buyer model, we flip the script. We say, okay, we'll use donated dollars, we're going to buy that debt, but we're actually not a debt buyer. We are not going to go and try to do another cycle of collection, phone calls, wage garnishment. We are just going to get rid of it. So we send people letters letting them know that that debt has been eliminated and abolished, and they are no longer responsible for it. So that's our mission. We are out there to abolish as much debt as we possibly can. And we do it for a very focused group of people. We do it for people that earn under 400% of the federal poverty level, which is a little bit under, $100,000 for a household of 3 or around $53,000 for a single person. So we're really focused on people in low and moderate incomes and helping them manage unmanageable, unpaid medical bills. Right? So that's our mission. That's what we do. We also help people when their medical bills are very large, like so if they're more than 5% of their income. So as you can imagine, if you have cancer or you're in a car accident, those bills can be in the hundreds of thousands of dollars. So it's really making sure that we're not leaving those people behind either. Next slide. So I want to start today just to talk a little bit about, this is a map of Michigan, and talk a little bit about what the debt looks like in Michigan. Miranda sort of highlighted some of these statistics, which are really hard to see, but just keep in mind that the darker the blue, the more debt there is in the county. So what this means is that there are, anywhere from like 15 to 18% of counties have medical debt in collections. So, and this is actually not all of medical debt. So there's some medical debt that actually makes it into collections, and there's some medical debt that just sort of lives out there but doesn't actually go into collections, but it's still there, right? It's still weighing on people. It's living in, cabinet drawers and in recycling bins because people don't want to open them. So for Michigan, we have an example here of someone we helped in Northville, Michigan, which is, you guys can probably have better geography than I do, but I think it's closer to the Detroit area. And for this person, we abolished over $2,000 worth of medical debt. And there are 3 things I want to point out about this story. The first is this person no longer has to worry about, says that I no longer have to worry about choosing between paying a medical bill and putting food on the table for my family. The second is that I am financially relieved and emotionally relieved. The third is that anyone can do this. This is a unique moment. It is a launch pad to have a community conversation, and it is a community builder because it brings people together to see that somebody would step forward to help them in a moment of need that is a stranger that they don't know. And that's powerful, particularly in this moment. Next slide. There we go. It's hard with the light, so I'll read you some numbers. So there was a study that was released a little while ago, a couple weeks ago, that looks at census data. It's really hard to figure out how much medical debt actually exists across the country. The data's not very good. We can figure it out through some surveys and different questions. So, but from the census data, when people asked about how much medical debt they're carrying, it's estimated that there's $220 billion worth of medical debt in this country. That's a lot of debt. So just to give you a little bit of an example, we've abolished $10 billion worth of medical debt at RIP Medical Debt. We're really proud of that, for 7 million people. But that's nowhere near 220 billion. There's a lot of work to do, right? So, and in a different survey, they asked people, well, how many people are really struggling with their medical bills? And 1 in 4 people are struggling with medical bills. And this isn't surprising, right? You get a bill for like $900,000. I'm glad someone pointed it out. Was it Andy that pointed it out? It's January, February, right? Everyone's got a restart on their insurance plan, and they're having to pay those those high out-of-pocket deductibles. And, you know, I know in my house, they're like coming in like wildfire. My husband just had an MRI, $990. My child had a sick visit for a cold, $380, right? They keep coming, and it's overwhelming when you have those high deductible schemes where you are responsible for paying cash out before you get any help. And you're like, why did I get insurance? So, but for 100 million people are struggling with medical debt, and they range with all kinds of problems, right? They owe money to family and friends, right? They are putting it on credit card, which, by the way, when you put your medical bills on a credit card, it's not medical debt anymore. It's financial debt. Different rules, different game. Really important to remember. They owe money to a bank, right? Or they're trying to pay a provider over time. So these things stack up and create a lot of stress for people. Next slide. So it's also what's really important to us, and why we do the work we do is not just about helping people and giving them hope and relieving that emotional stress. It's about getting people to go back to the doctor. So when people are scared about unpaid medical bills or they owe medical debt, they're less likely to return and get the care that they need. It creates a tremendous amount of anxiety or worry. And as we heard from that first story about CW, people are making trade-offs around food, right, around housing. It's affecting their credit rating. We heard that from the focus groups. People can't get access to the credit they need to live. You can't live in this world, right, without access to credit. So these are just sort of the layering of problems that people are experiencing. Next slide. So when you say who's struggling, it's actually just expanding. So people used to think about medical debt as an issue for the uninsured. People that don't have insurance would accrue medical debt. Sure, and that is still the case. And it's more likely that if you're uninsured that you will have medical debt. But it's also increasingly people with insurance that have medical debt. So the number one driver right now, particularly for physicians and for hospitals, is they're being put in the position of being debt collectors with these new insurance plans because people can't afford their out-of-pocket costs. So they think they're insured, they think it's protecting them, but actually when they show up for care, they're finding, wait a minute, I don't have $5,000 to pay this. How am I going to get the care that I need? So increasingly, that's a problem. And logically, people that are in poor health need more medical care, and therefore they are accruing more medical debt. And those individuals also happen to be low and moderate income people that are not getting access to a full range of supports and services that they need to be healthy. Next slide. So let's talk a little bit. This is a little wonky. I'm going to make it in plain language for you. Next slide. Let's talk about what's happening in the federal landscape we like to talk about in the policy world. And this is a lot of small intricate language, but I'll sort of walk you through the timeline. So in 2022, the Consumer Financial Protection Bureau, so this is a federal agency that kind of, oversees banking and finance and sort of regulates kind of how those entities operate. They really noticed an uptick in consumer complaints around medical bills. So they decided to release a big study and look at the problem of medical debt across the country. And they found it was pretty alarming. Right? And so when they released that study, they had another set of players come to the table and say, wait, we're going to make sure that medical debt's no longer on credit reports. So everybody knows kind of TransUnion, Experian, these credit agencies, they voluntarily said, okay, look, if medical debt is under $500, we won't put it on people's credit reports. So that's a really positive step at the federal level, but it's voluntary, right? So then sort of momentum grows, and and Vice President Harris announced an executive order where they're going to say, well, we're going to make sure that we know that medical debt doesn't affect your credit in the way that, like, if you have medical bills, does that mean you're not credit worthy? So they started to pull that into the implementation of how they provided loans to farmers or to small businesses. And then they also streamlined making sure that veterans could have access to getting rid of their medical debt. So those were all really positive moves, and they're what we call on the administrative side of the federal government. So these are all things that the government can do without passing bills through Congress, which is an impossible task these days. In 2023, there's more momentum, right? And then the Biden administration decides to focus on medical credit cards. So as I said before, when you put medical bills on a credit card, it's financial debt, not medical debt. And you lose some protections, and it changes how it shows up on your credit report. And so there's been sort of ongoing work to understand how credit cards are being integrated into the sort of, the medical practice. So many people probably are most familiar with medical credit cards based on dental care. Like if you have a child that gets braces, or if you go for dental care, you might get access to some kind of form of credit to finance that. So we're seeing that increasingly show up because people can't afford the bills that they're getting, and so then they're being financed. So looking at protections for that. Whoops, back one slide. And then finally, there's sort of a movement as well, even within Congress, a number of bills are introduced to make sure that medical debt doesn't show up on people's credit reports. And then this year, we're just seeing also an uptick where we anticipate that the Consumer Financial Protection Bureau, this federal agency, will make that permanent. And so they'll say that those credit unions those credit agencies like TransUnion and Experian can no longer put medical debt on your credit report. So that has yet to play out. Next slide. So states are actually where it's happening. So, states are always sort of thought of as sort of the, they are the incubators, right? They are the place where you build policy and then the federal government looks to make it final. Next slide. And we're seeing a lot of movement in two areas in states. And I'm going to show you some maps in just a minute that can help you see where that's happening across the country. But the two areas that people are really focused on around medical debt that really are kind of what we would say proximal. They're short-term solutions, but they're important. The first is shoring up financial assistance. So it's making sure that when and if you go to a hospital, if you need financial assistance, that you know it exists and it's easy to access. So if you are if you are a low or a moderate income, that you actually can access free care if you qualify for it. So there are a number of different ways that states are doing that. Some of them are saying every hospital shouldn't have a different policy, it should be the same. So they're setting standards that are for all hospitals. They're saying this shouldn't just be for nonprofit hospitals, it should be for-profit hospitals too. So it's kind of making an even playing field. The same on the debt collection side. So some states are passing laws to cap, can you charge interest on medical bills? Can medical debt accrue interest? So it's capping some of that. Banning things like suing people, taking their assets, their homes, their automobiles. We're seeing some bans in states on that. And also limiting how much people will pay over time so that they're not paying for 20 years if they owe a medical bill. Next slide. And these are just some examples which are hard to see in the light, but you can see that Michigan is not shaded yet. So the first is sort of, we talked about setting standards for financial assistance. So making sure that there's a floor that everybody has to abide by. These are the states that are looking at that. Next slide. Here's some examples of states that are putting limits on liens and foreclosures. So making sure that people you can't have your home taken away from you if you have unpaid medical bills. This is really important. Next slide. Here's one. This slide shows states that are looking at banning credit reporting of medical debt. So making sure if you have unpaid medical bills that you're not losing access to credit. Next slide. And here are states that are putting preconditions before you can send a bill to collections. So before a hospital or a provider sends a bill to collections to sort of hound you to pay that bill, are they really making sure that they've checked all the boxes? Do you qualify for Medicaid? Did they screen you for financial assistance? So giving you a waiting period, trying to reach out to you before it goes into collections. So those are some of the steps that are now being required in some states. Next slide. So for us as an organization, we sort of pull all these stories together from our beneficiaries, and we're learning a lot from working with Access Health in Michigan about what's important to community, to think about how we can sort of take these voices and amplify them to build what we call an upstream agenda. Like, how do we get to the root cause of medical debt? Well, first of all, we make sure that people have access to affordable coverage. That's something that they can actually afford. Right? And the second is we make sure people know that financial assistance exists and it's easy to access. And the third bucket is really about banning what we call extraordinary collection actions. So those are things like lawsuits, taking your home, your automobile, your assets, things like that, so that we make sure people continue to economically thrive despite having medical debt. At the end of the day, I think, when we talk about stigma and we talk about medical debt in general, I mean, our mantra is that medical debt is not a debt of choice. It's a debt of necessity, right? And I think it's really important to keep reminding ourselves of that. Next slide. Next slide. So now I'm just going to highlight for you just very quickly, like how this all happened, like how did we get this big uptake? Well, a lot of it was driven by medical debt in the media. So there has been a lot of conversation about medical debt thanks to actually a reporter. His name is Noam Levy, and he's from Kaiser Family Foundation Health News. And he has done a series of stories over the past 3 years. And if you actually Google diagnosis debt, you'll see them. We're really highlighting the universality of this issue. It's something we all experience. Next slide. And we had the opportunity then following the sort of launch of sort of this issue last year, we sat down with our friends at the American Cancer Society and Leukemia Lymphoma Society and decided to do a national poll to really understand how people were feeling. And uniformly, regardless of background, there's uniform support that medical debt is a terrible thing that no one should experience. And if you can just sort of see the feelings people have because of their debt, I mean, this is an actual crisis that needs attention. People feel trapped. They don't feel like they'll ever be able to pay it off. They feel in tremendous shame and embarrassment. Many try to compartmentalize it and forget that they even have the debt. This is the #1 source of bankruptcy for people across the country. And it's so sad that many people feel their life is ruined from medical debt. Next slide. And what's interesting, though, is this general agreement that I talked about, which is that medical debt is not an individual fault. It's the fault of institutions. And that's something we need to keep reminding ourselves and our neighbors, right? And 86% of people agree that really the issue with medical debt, it's not the individual, it's the institution, and the problem is really about a hyper-focus on profits over a focus on health. Next slide. So most people are really struggling. We saw this in the focus groups. They're struggling to make really tough decisions about food, about housing and trade-offs. And they're really concerned about going into medical debt. And many say that every day they get bills that they can't afford. I mean, just think about that. In January, you might get 6 different bills if you have healthcare needs that could add up to $3,000. I mean, that feels untenable for a family, particularly with that, fact that's quoted from, it's often talked about a lot, is that most people in this country can't afford a $400 surprise bill. And then most importantly, that 1 out of 5 people don't go back to the same provider because they're embarrassed or because they don't want to have to deal with the fact that they couldn't pay for that bill, so they try to find someplace else to go. And that's hugely problematic for their health. Next slide. So next, Gregory's going to come up here because I've talked too much, and he's going to talk a little bit about the community work that we've done in Michigan and what's next. And I'm going to take my water.
Thank you, Eva. I think everyone can hear me okay. Miranda, I don't have that many slides, so thank you again, Eva, and thank you, Access Health, and thank you, Andy. I'm Gregory Brody, so I'm the program manager for community engagement at RIP Medical Debt, and so I manage our relationship that we have in our our partnership with Access Health here in Muskegon. Let's segue, digesting all of that, and ground ourselves a little bit. Policy takes time, I think, is a succinct way of putting that. And social issues that require structural change don't happen overnight, which can be frustrating and it can be discouraging. However, so this slide here, this visual is kind of a cliche, right? But I think it bears repeating, and I think it's a good attunement to remind ourselves that the community work that we know this community here in Muskegon is familiar with, so pre-exists our partnership and is the history that you all have. But the community work and the grassroots work is what plants those seeds, right, to grow the tree that bears the fruit for the social change that community needs. So again, I just wanted to kind of pause, take a second, exhale, because it's the community change where often the social change happens first. You can go to next slide. So RIP Medical Debt knows this firsthand, right? So when Eva was brought on into the organization to lead our policy initiatives, it was an obvious addition to start thinking through community engagement. We're a national organization. We move fast, we have high impact, and we're really proud of the work we do. But we also have the benefit and this interest in knowing how we can ground ourselves to really see the impact that much closer. So summer of 2022, we partnered with Communities Joined in Action, which is a national organization. It's a membership organization for community health collaboratives, of which Access Health is one. So we launched a pretty competitive application process and lengthy process that Access Health applied to. We learned about you all through an application first, and then we learned even more when we had our interview process and learned firsthand that we were working with an organization that knew what it was doing and a community that would hold us accountable to what you all were doing. And that was apparent. So we were excited about that. We signed on to launch this partnership for 2 years, right? And we're about a year and a half in. In winter 2023, as Miranda had mentioned, we had a regional debt file that we secured to abolish $25 million of debt for nearly 40,000 people in the Muskegon County area. And we were able to, again, not only partner with Access Health and learn from them as partners, but learn from the community here in Muskegon about what that impact really was through the focus groups and through the Livability Lab that was launched by you all, Livability Lab 4.0. So off that momentum, right, we had the debt abolishment, and then we did our focus groups across stakeholders that Miranda mentioned in Muskegon, and then we had the launch of the Livability Lab, which you all know firsthand. We're here and now, right? It's February 2024. We've wrapped up, I know you all wrapped up with the celebration around the Livability Lab, and now we've been trying to think through the impact that the medical debt action team has had, not only prior to Livability Lab 3.0, but also here in 4.0, and the ways that we can leverage the work that you all are doing and continuing to extend it. So a lot of this work here right and now requires community interventions, right? So if we go to the next slide, we know that a lot of the diagnostics that we see for communities as a national organization is we can encourage them to think through ways that they can identify and train issue champions. We can do listening sessions with community leaders. The list goes on. The list is a reflection of what you all have done here in Muskegon, right? We could talk at length about all of these, but you all have experienced them, have organized around them, and have used them to leverage the change that you all are trying to emulate in your community. So this partnership has been a two-way learning opportunity, both for us and as we have endeavored with you all. Something I wanted to highlight was that the main, and here, right, this is an intervention today. So one of the major things that it bears repeating and highlighting and letting it sink in is the stigma and shame that accompanies medical debt and the alienation that then comes with that stigma and shame. So extending the conversation, having the conversation here is an intervention as much as extending and continuing the conversation remains an intervention in cleaving that shame and stigma that's attached to medical debt that we know people endure as patients. We can go to the last slide. So the idea that we have one last slide, Miranda, maybe if you want. Yes, perfect. So now what, right? And that's kind of rhetorical because we're already in the midst of the now what. We're moving ahead. We're trying to think through. We have the medical debt action team still continuing to engage this subject. And we want to be in partnership with Access Health and with you all here to maintain that momentum, to continue leveraging that energy and the interest and the narrative building around, again, combating the stigma so that we can continue this conversation. So I know we have a roster for the rest of the agenda. I just wanted to take a moment again to thank you all, to thank Access Health, all of the contributions that have gone into today. And thank you again, Eva, and thank you all so much.
One of the great partners here at the Medical Debt Resolution Seminar today is CeCe Riley. CeCe is with the Hackley Community Care organization, which this is like year 2?
Year one, actually.
Year one? 1.5. You've been there for a little bit.
Not even
No?
one. Less than one, actually.
You still turn a marvelous color of red, and thank you for that. you know you're dealing with me, right?
I do.
Talk about Hackley Community Care and your role here in Muskegon.
Yeah, absolutely. So as you said, I'm Cece Riley, the marketing director at Hackley Community Care. We are a federally qualified health center here in Muskegon County. So we specialize in serving individuals who are on Medicaid, underinsured, don't have insurance, and we serve from primary care to mental health. We have a pharmacy, we have an urgent care office, and we welcome all of Muskegon County to access these services. We also offer sliding fee scale and prescription assistance programs that can help individuals not get into a medical debt situation.
I've been very fortunate over the years to have had a role in helping out with some of the messaging and things with Hackley Community Care, and it really is an outstanding group of people that come together to make this community a little bit better with the work that you guys do. As you're getting into learning more about it, what are you seeing that is something that's new to you and opens your eyes about the work?
Yeah, so I've been at Hackley Community Care right around a year, and I did not realize the breadth of services that we offered prior to working here, or where our services are accessible. So we actually have 26 locations across Muskegon County. 18 of those are embedded within school districts here in the community, and so most of those entail mental health services in those schools, but we also have nursing in some of those schools and 2 full-service teen health centers as well. And so I think that's something that I didn't really realize, just the breadth of how accessible services through Hackley Community Care are.
There's a lot. And then to get you guys right down there with Now Care, where it is now at the old campus downtown with that new school coming along, I mean, that is really a great neighborhood asset to have down right where it's really needed.
Yeah, I think a lot of people don't realize that we purchased the old Hackley ER about 3-4 years ago, and we operate an urgent care that's open county-wide out of that space. You don't need to be a patient of ours to utilize that, and we do sliding fee scale there as well.
Don't I know it? I've been there, right?
So have I, and so has my family. But we're actually in the midst of a $4.5 million renovation project at that building as well. So we're adding primary care, mental health, and a drive-through pharmacy there, and we hope to have that all open by the end of the year if possible.
One thing that we see, and I think a lot of people in Muskegon think about, is that it's competition between all the different healthcare entities in town, but you actually all work together. Can you talk to that just a little bit?
Oh yeah, we work together all the time. I mean, there are enough people in this community that need access to medical care that it doesn't feel like competition at all. Just in fact, this past fall, we partnered with the Osteopathic Foundation and Trinity Health and put on a women's health fair event. And we do that kind of stuff all the time, partnering with our local healthcare providers to really meet people in the community where they are and make services accessible and affordable.
Final thought on Hackley Community Care.
It's amazing, and we offer so many great services that we just hope the community gives us a try and comes and checks us out. We are open to new patients in mental health, dental, medical, you name it.
Next time I smash a finger, I'll be down.
Yeah, come see Now Care.
Now Care. Cece Riley from Hackley Community Care. Always great to see you. Thank you for your time today.
Appreciate it.
Next up, we're going to be talking about Access Health, the presenters of things here today at the Van Dyke Mortgage Center. Access Health is a major player in our event here today, and you guys are some of the key players behind the scenes at Access Health. You didn't know you were getting thrown on camera today, did you?
No.
Shoni Blake is here, and this is Adam Birchmeyer from Access Health. Shoni, talk about your role at Access Health, because you are one of the coordinators of some pretty big things that go on in town.
Absolutely. So at Access Health, I originally got involved with the RIP Livability Lab team. We gathered together to talk about strategies in order to help our community reduce medical debt. So originally, that was the goal. We still meet. And I'm here today to talk about and educate residents on Medicare, Medicaid, and the health exchange. And then Adam is going to be talking more about Access Health health plan coverage.
Adam, the health plan coverage that you guys offer through Access Health, I got a quick peek of it, and it's really quite remarkable. I mean, the prices I saw in there did not generate any sticker shock whatsoever. Talk about that.
It really is a game changer in this community. Our C3 health plan through Access Health is really our legacy project. It's a $0 deductible health plan for $72 a month. Employees can get that through a local employer if they do participate with Access Health, and it really reduces that medical debt conversation with our members that are on our C3 plan.
there's a lot of confusion about these programs out there. And I mean, I watch some television and all that kind of stuff, and these all things pop up. It's a lot for me to try and pull in. And I think I'm pretty good at consuming information. If people need to learn more about this stuff and find out how they can get their employer involved and all that kind of stuff, where do they start?
They can start right on our website, accesshealth.org. Our contact information is right there. We try to really streamline our process. We say that we bring a little bit of common sense to
No, really? Common sense somewhere?
some common sense, some personality. You're always going to be speaking to a local resident here in Muskegon County when you call us. So we really just try to educate and really empower our members as well as the employers to do what's right for this county and this community.
When you're doing projects like this, Shoni, you've got to see the level of personal impact that you have. Talk about the difference you make in the people you see.
Absolutely. I still have past patients come up to me and ask me questions. I often give out my cell phone number to patients for easy access because we know that is most of the hardest part to getting access to care is getting your providers and your health coaching, get access to your health coaching. So I still have patients that call me and ask me questions, and I always navigate them back to Trinity Health.
Give me a success story that's made you feel pretty good about your work.
Success story is being with our members and making those small changes that end up having a bigger impact. Hearing some of our members say, now I can finally go to a provider's office and not have to worry about the end result, which is that big bill.
Yeah, it's a lot. It's a lot for everybody. You guys are awesome. Thanks for the work you do. And we're going to be back up towards stage in just a couple of minutes with some more great information. All right, we are back, and we are ready to introduce our next speaker from Trinity Health, West Michigan's Pharmaceutical Access Program. I'm not sure if I know this guy's brother or not. If he's got a brother named Tom, well, then I certainly do. No, I don't. Okay, so good. You're safe. Please welcome up Ron Rademacher. He is the Regional Pharmaceutical Access Program Manager for Trinity Health. Ron, thank you for coming up.
Good afternoon. I have spent over 26 years with Trinity Health, and the last 8 of which I've been working through the Health Project, which is the community benefit arm of Trinity Health. They had a pharmaceutical access program that I was very much involved with when I was managing their retail pharmacies. Trinity Health has core values, which many of you have already read: reverence, commitment to those experiencing poverty, safety, justice, stewardship, and integrity. We live our mission, and the idea behind that is taking the Health Project, which used to be a standalone organization under Trinity Health, in order to make the impact, a greater impact within the community of Muskegon. Next slide. This is just a map of our service areas, of Trinity Health Michigan service areas. I work with Pharmaceutical Access Program in both the community of Muskegon, which covers the Lakeshore all the way up to Mason County, down to northern Ottawa County. But I also work with Trinity Health Grand Rapids, which covers Kent County, Newaygo County, Ionia, you name it. We've got basically the western portion of Michigan. Next slide. Next slide, we'll skip that right now. Okay, I have a total of 6 community health workers in Muskegon that work on my team, what we call the Health Projects Enrollment Team. We have another 12.5 community health workers, both employed through Trinity Health and contracted with Trinity Health, providing a variety of services, navigating patients through the healthcare system, and assisting them with other resources throughout the community. The Health Projects Enrollment Team helps with assessing an enrollment for the ACA Marketplace, Medicaid, Medicare, Trinity Health Financial Assistance, which we'll talk a little bit about, Lions Club Vision Services, the Pharmacy Assistance Program, which continues to grow in this community, just because the need continues to grow, and then most recently the Patient Care Fund. just to talk about, to make sure everybody is aware, Trinity Health has a financial assistance program and has had for years. However, oftentimes, people aren't aware of it. They incur the medical debt, and then they're trying to figure out what to do with those bills when they come. And oftentimes, they put them on, as was pointed out, on credit cards, on medical cards, that type of thing, and they carry that debt. There is a financial assistance program. We, at the Health Project, spend a great deal of our time assisting patients in completing that application, gathering the necessary information, filing it with home office so that we can get much of that bad debt written off. There are a number of, if you have access to MyChart, you can apply for financial assistance right through MyChart on your smartphone, okay? You can call, there is a website that you can obtain the application, or you can, if you need assistance or have questions, call the Health Project, okay? We're located in the Hackley Professional Building, right on Leahy Street in downtown Muskegon. So we'll be more than happy to walk you through that process. The most important thing is when you're dealing with that, let's take care of as much of that debt as we can. But at the same time, while we're doing those screenings for financial assistance at the Health Project, we're also looking at your insurance coverage, okay? Are there opportunities to improve your health care coverage? Or is there some things about your health care coverage that you weren't even aware of, benefits that you haven't been able to use because you just didn't know you had them? It's especially true with Medicare. Medicare is one of the most complicated insurance coverages out there, be it straight Medicare with supplements and Part D, or the Medicare Advantage plans. And many people don't understand the coverage they have. They just sign up for the plan because they're told I got to get insurance. And they don't know how to optimize. When you've got 40-some plans out there to choose from, how do you know which one's best for you? So I would always encourage people to go to a Medicare counselor, try to go to a MAP counselor at the Senior Resource Center at Tanglewood, or at the Health Project. We have MAP counselors that do unbiased Medicare counseling. Oftentimes when you talk to insurance agents, they're trying to sell you a policy. Keep that in mind. There are some very good insurance agents that do a good job, but there are others that are just looking for a paycheck. And you could end up in a policy that doesn't suit you well, or doesn't even cover the provider that you go to. Okay, we'll go down. Our pharmaceutical assistance program was created to identify people in need for prescription assistance, and that has come up on several slides today. Medications are expensive. Many medications are expensive, and you want to get the medications that you feel are going to be best for you, or that your provider feels that are going to be best for you. But oftentimes when you get the price tag, you go, I got to do something else. Or in many cases, I'm just not going to do anything. I'm going to bide my time and hope the problem goes away. Okay, we designed our programs so that we literally have people that will make referrals to us through every door. The providers are aware of our program, pharmaceutical assistance program, and that's true of both Trinity providers. Also, many of our Corewell providers are aware because we've been in the community long enough. We get referrals from private practitioners. The idea is if you get your medication and you're able to take your medication the way it's prescribed, you're going to be healthier. You're going to avoid hospitalizations or readmissions, and that's the target. It's much easier and much less expensive to stay healthy than to get healthy after an acute setting like the hospital. We assist the uninsured, Medicare Part D. We insure or assist marketplace enrollees, because any of you been on the marketplace, you know an affordable marketplace plan also comes with oftentimes a pretty hefty deductible, which is also unaffordable. You might have to pay $5,000 before they pay your first prescription. So we're there to help with those needs. And we link, while we're doing those enrollments, we also link patients to other health and human services that are available out there. Again, dealing with the senior population, we'll screen for individuals who may be eligible for Medicaid, Medicare Savings Program, which will pay their Part B premium, low-income subsidy through Social Security, which will not only pay the premium of their prescription drug plan, but also lower the cost of their prescription copays. Huge, huge thing. And every day we see patients, our seniors or disabled, that are eligible for these programs but didn't know they were eligible. They don't know of the programs. They're out there. Again, it pays to talk. It pays to get the word out. We try to be as transparent as possible, and we count oftentimes on our providers on saying, hey, I've got a patient who can't afford their prescriptions. What can we do for them? Can we refer them over to you? We get involved. We see what we can do, and we'll take a multitude of different tacks. Next slide. These are the various programs that we offer under the Pharmaceutical Access Program, okay? We go through the drug companies when possible. Many of the drug companies offer assistance programs for up to oftentimes 300-400% of FPL. For some of the very expensive drugs out there, it has an even higher threshold for income to be qualified. We also have what we call the Low-Income Pharmacy Care Program, and that is a program that is administered, qualified and administered through Trinity Health, Muskegon, okay? When you need assistance and there isn't a program for you, or it just makes more sense, the hospital has a program where we will actually we'll qualify you just like we would with financial assistance. We'll qualify you for a 6-month period of time to assist with copays that are barriers to you to afford, okay? That 6-month isn't just a one and done. You can reapply. Just like the financial assistance with Trinity Health, you can reapply every 6 months. We have some patients that have been accessing the LIPC program for years now, just because their income doesn't go up. They're always in need. And so they come in every 6 months, bring us the documents, and we take care of reauthorizing their meds. The interim medication fund is a one-time authorization that we use for immediate needs. Oftentimes, patients who are seen in the hospital and you're all of a sudden diagnosed, as an example, as having diabetes, and they want to put you on insulin, okay? Or you have an exacerbation of asthma and they want to put you on a maintenance inhaler. Oftentimes these drugs can reach hundreds of dollars, and yet you need them both to be stable getting out of the hospital and to avoid a readmission into the hospital. We work with the case managers in the hospital to provide that assistance immediately, and then they make the referral back to us to find a long-term solution to your medication needs. Our provider offices are doing the same thing. We have PharmDs embedded in the provider offices. We also have care managers in the offices. They're all aware of our program and will make a referral. If there's an immediate need, you're out of your medicine, you just change jobs and you're without insurance for 30, 60, 90 days, we'll be able to utilize that one-time authorization to take care of your immediate needs and then decide, okay, what's the next step? We never want to leave people out there in limbo. It's, as I tell our care managers, case managers, we've got to be conscious of what we're doing and we have to have a plan, short-term, long-term. Don't put them on a drug that you can't access later on. We need to be smart about this. Put them on a drug that their insurance company will pay for, and believe me, there's as many or more people that are underinsured in this community as uninsured. In fact, far more underinsured. So we always try to develop those plans for long term. Those few dollars, those low-cost generics where you have to pay $2, $3, $4, those are usually not the medications that people are running into problems with. It's the ones where they're having to pay $50, $60, $70 for a month's supply, sometimes well over $100. Those are the ones that people are having issues with. The Patient Care Fund is the most recent addition to the services we provide. These are funds that were actually contributed by colleagues and providers through Trinity Health to create a fund by which we could provide short-term, oftentimes just one-time assistance for things other than medications. Just to cite example, somebody goes into the hospital after a car accident and they need certain durable medical equipment in order to ambulate around the house. If they don't have insurance, it might be a matter of providing them a wheelchair, a walker, crutches. If they have insurance, but their insurance doesn't cover those items, and we have, like Medicaid. Medicaid doesn't pay for certain durable medical. They'll pay for the crutches, the walkers, and that type of thing. But a commode, because you can't go up and down the stairs to use the bathroom, they don't pay for that. The case managers over at the hospital will say, hey, we've got this situation, can you help us? That's what the Patient Care Fund is. Somebody who has a severe wound and needs dressings, that's what the Patient Care Fund is, okay? We repaired a CPAP machine for a patient. So that's a new one. And the Dispensary of Hope, that is a program that we subscribe to here in Muskegon. It is run nationwide. They have a network that they work with pharmaceutical companies, and we're able to obtain medications through the Dispensary of Hope for uninsured patients at no cost to the hospital and no cost to the patient, okay? Just as an example, the Dispensary of Hope works with Lilly. And so insulin, Trulicity, and those kind of meds, which are very expensive, we can obtain through the Dispensary of Hope for uninsured patients up to 300% of FPL at no cost to that patient. So, all right, next slide. Who can we help? Uninsured and underinsured with high copays or high deductibles, up to 300% of federal poverty level. That's our target. There are patients who have incomes 300 to 400%. We may be able to find programs depending on what the need is for some of those drugs, but our target is from 0 to 300%, and that covers a great deal of people. And there is no copay in our program. When we provide assistance, you go to the pharmacy, you pick up your prescription, and you walk out. All you have to do is sign your name. Next slide. Okay, how does it work? It's a one-stop shop, comprehensive screening and enrollment assistance for eligibility determination. We use Trinity Health's financial assistance application as a guideline for eligibility through looking at income and assets. We're able to determine not only financial assistance for your medical bills, medication assistance, but we're also looking at other programs that you may also be eligible for that we can enroll you in or at least direct you in. So we have a team, like I say, a very large team of community health workers that are very good at their jobs, and they love to help people source resources. Alignment, I've already said, it's aligned with the financial assistance program. Verification of access to appropriate primary care services. We run into all the time with hospital discharges, patients who are discharged but haven't seen a primary care in years, don't have a primary care. So we will assist with finding a doctor for you or moving you to a doctor that provides the care you need with the assistance that you need. And then, of course, accessing prescribed medications and supplies through our pharmacies. coordinated referral with support services and programs. So it's designed to look at the patient holistically. Oftentimes, you'll find many organizations will only look at one element. We try to look more holistically and say, okay, if you have housing needs, if you have food needs, clothing needs, house repair needs, we try to look for those things and we'll make the appropriate referrals and get you assistance in those other areas too, because they all count. With the Pharmaceutical Access Program, because I have a background in pharmacy, my inclination and my drive is to avoid people having to make the decision whether they can buy their groceries this week or take their medicine. And oftentimes, it's the food, it's the groceries that are the last stop. They'll pay their housing, they'll pay their utility bills, and we hear it all the time. What do you spend on groceries? Whatever I have left at the end of the month. Quite simple. And I say, well, what would you like to spend on groceries? But that's our goal, is to help people with that and to avoid increasing your medical debt. People using their credit cards to pay for your prescriptions. Next slide. Applying, we have a community health and well-being office in Grand Rapids and Muskegon through the Health Project. If you go to a provider and you're having troubles with assistance, talk to them. They'll give you our number. You can talk anybody at the hospital. Call us. We have brochures at our table. We're easy to get a hold of. We have a website. I give people my personal cell phone number to call. We try to be as transparent as possible. What we use is a 3-page financial assistance application, and the documents are your insurance cards, proof of household income, your bank statements, medications, and ideally, and this goes most especially for Medicare recipients, your explanation of benefits, although Marketplace, it's tricky too, the explanation of benefits, or at least know your deductibles so that we can look a lot of that information up, but if you bring it in, it's much easier. And then, of course, your explanation of benefits for Medicare, because then that gives us a tool by which to decide whether we're going to the drug company or whether we're going to assist on a standalone. Next. Okay. Like I say, this is just an example, which I've already listed. Medicare beneficiaries, we always screen for the low-income subsidy, the Medicare Savings Program, and dual eligibility for Medicaid. If you have Medicare, doesn't mean that you won't qualify for Medicaid. Medicaid won't pay for your prescriptions. However, dual eligibility gives you a whole lot more benefits. There are some very, very good plans out there that offer substantial money back or money for utilities and other things. So this is all done automatically. Again, looking at the whole person. Next screen. Okay. That's our contact information. It's on the brochures there. My email, if you want to write that down. If you have questions, feel free to ask. I have my Liz Chala Hidalgo is in the back. She is my partner in crime when it comes to this program. And like I say, we have a whole host of community health workers out in the community that you'll see around. And next screen. The key is how do I put it? Ask questions, inquire, okay? Don't sulk, don't worry, don't stress out. Ask around, ask your providers, is there any assistance? We're out there, but again, we can't be in every home, so we count on our network getting the word out. We count on each and every one of you getting the word out. If you don't have a need, but you have a grandparent or a parent that has a need, that you know they're cheating their health because they're not taking the medication the way they should, say, I know who you can call. Just call the Health Project. Just a reminder, the Community Health Needs Assessment Survey. This is a survey that is done every 3 years that assesses the needs of the community. It's log in, take the survey, express what you feel are the primary needs within this community. That information is then bundled together, and organizations such as the hospital, the health department, and other organizations in this community use that information to prioritize the work they do for the next 3 years. So it's real important that we get as much feedback as possible. We have flyers back on our table. You don't have to copy the link right here. Just pick up a flyer, take it. It closes tomorrow. So take it today, take it tomorrow, but take it. All right. Yes?
To bring it full circle, that data is used within Livability Lab too.
Yes. That data is used.
Please,
Yeah. Yes.
help so many organizations prioritize their work.
And the more responses we get, the more accurate the information is going to be. And we want a representation of the community. So please, parents, grandparents, encourage them to take it too. Get on the phone tonight.
If you want change to happen in the
Yes,
community, there's.
that is the opportunity, because that's where we put our dollars. Okay.
So, hi, I am Samantha Cornell from Access Health, although today I'm here wearing my Shire hat, because I also serve as the director of the Muskegon Shire, which hosts Livability Lab, hence the shirt. But I'm grateful to welcome some special guests today who are going to tell us some of the personal experiences and impacts of medical debt. So I am pleased to welcome Judy Kell and Samantha Scott. I suggest that you use the stairs. It was a big step. Well, I think you're more coordinated than me, Judy.
No, I don't count on me.
We could do that up here.
Oh, I get the middle seat.
You want to trade? I could. No, you're
We'll
good.
trade names first.
Yeah, we should trade names. I know. I thought about that. I was like, another Samantha. That never happens.
I know.
So, first off, thank you, everybody, for coming, and thank especially to Judy and Samantha for being here today. Within the lab, if you've had the opportunity to attend the lab, but if you haven't, you know, the secret is that there'll be another one, so you still have chances. But the lab is really, it's a community action engine, and that's, it forms action teams. Residents and partners within the community form action teams to make change in our community, to make the community a better place, to make changes, to make positive changes. The theme this year was building community together, because that's what people told us they wanted to do, is come together to make positive change. But what those changes are decided by community, and that's really informed by data. And as we talked about earlier today, stories are data, right? They're important data. So we bring the numbers and the charts and all of that stuff that is really cool. And I'm looking at you, Laura, because I know you share my love of it, right? And the stories too, right? Those stories are powerful. And I think, you know, you two coming here today to tell your stories, as we've talked about medical debt, and we've talked about the impact, and we've talked about that it's a structural, systemic problem, but it has a human impact, right? And when you're trying to change systems and to figure out how to, what to move and what to change to impact those systems, you have to do it within the human lens. So it's so important to tell those stories. And it's even trickier with medical debt, because really, I mean, you guys are, thank you, because who really wants to talk about debt? I mean, do you wake up in the morning and think like, I want to talk to somebody about debt, right? It's tricky, but we're not going to be able to address it if we can't talk about it, right? So all of you coming here today to talk about it and to be a part of this, and especially you two here to tell the stories, just thank you. So I'm going to start to hand the mic away so I don't fill up the whole time talking, but if you want to introduce yourself briefly, and then we'll start talking.
Okay, do you want me to tell my story or just who I am?
You can, who you are first, and then we'll.
My name is Samantha Scott, and I have lived in Muskegon for about 10 years. I don't know, I guess a fun fact. I feel like I need to talk more than just say my name. I own a business in town, Preferred Employment and Living Supports. We've been around since October of 2013, and I love the Lakeshore, so glad to be here.
I'm Judy Kell, and I grew up here, and I've returned 3 times for employment, and I am now retired here. So shall I start?
Sure, or you want me to? Let me ask the question and then
All
you
right.
can start, but I'll just hand it up, just so they know, because but really, I should just let you frame the question. But really, it's, if you could start by telling your story, you know, how, with a personal experience of medical debt, what was that process? What happened? What was the cause? And then, what just the experience? Okay, you want to go first?
I talk long, so hopefully I won't talk too long, and if I'm first, then you can nudge me off the stage and that'll be the end of it. I'll start with a story of 35 years ago when we adopted 2 children. One was 4 pounds at 4 months, and one was 10 pounds at 6 months, and we adopted them at the same time. This will give you the context of my medical debt story. As you can imagine, children in that kind of frail health had significant medical needs, which resulted in about $300,000 of non-reimbursable medical expenses that we ended up paying over the years, thanks to very generous employers who were kind enough to let me work a second job, doing consulting, from which the Health Project actually benefited from some of that, like the Drug Free Coalition and some of the other projects that I did. My husband also worked 2 jobs. And in the end, by the time between friends, family, and jobs, we were able to keep our house, we were able to keep our cars, our credit was not in great shape, and it took several years to overcome that. And of course, if you think about the context of the time, medical debt was continually given to one debtor and then to another and then to another, and then you never knew who you were paying, when you were paying, if you were paying on time. And then you would get these lovely calls saying, "You haven't paid us." And I'm like, "Oh, yes, I have. I have a receipt from you." So this was a very long process. It took us about 8 years to get out of it. It was not easy. What I can say is both of my kids have master's degrees and are gainfully employed, so every bit of that $300,000 was well worth it. Would I like to have a different house? Yes. Would I like to have had cars that were less than 15 years old with 200,000 miles on them? Absolutely. But it is very wearing, and I was fortunate because I was in a position where I could work that second job and work from home when I was doing it because I was doing consulting. So I would work all day, then I would work all night. I know people used to laugh when they would get my emails at 3 in the morning. But there was a reason why they were getting emails at 3 in the morning, because that's when I was working. My husband also worked 2 jobs, but we got it done. It was not easy, but now I get to be in the prime of my life with Medicare, and yet to begin to face the new face of medical debt coming forward. As an asthmatic, where everyone talks about Medicare diabetics. Yes, there are 28% of people on Medicare who are diabetic type 2, but there's 28.1% who have lung and associated diseases. And while I am extremely grateful that insulin is now being paid for through Medicare, as I look at my close to $300 a month out of pockets as co-pays, and my $4,000 a month shot that I have to have, which fortunately is paid by Amgen. And I can also thank our friend Ron for keeping me out of the donut hole for at least 6 months out of last year, because he told me to switch to another inhaler, which I did. However, it had to go through clinical review by the insurance company. Then the inhaler that you get, if you are not an experienced asthmatic, you lose it because it is an old-fashioned inhaler. And here is the story about inhalers. They used to be very cheap until the EPA decided that it was part of climate change. And now what the pharmaceutical companies are doing is saying that in order to prevent climate change, we are going to put these propellants in, which are no different than they were before. But they're charging now $600 a month instead of $50. So, you know, medical debt, we were out of it. I'm hoping we're not going to get back into it. But let me also tell you about another source besides our good friend Ron. Mark Cuban's Cost Plus Drug Pharmacy. If you have not heard of him, please. I got one of my doctors prescribed doxycycline, and when I went to the pharmacy, it was going to be $712.50 for a 30-day supply because it wasn't on the formulary. Why doxycycline is not on a formulary, I have no idea. So my doctor at that point said, well, do you know about Mark Cuban's pharmacy? And I said, no, I don't know anything about it, but now I'm going to tell you all, because you can go to costplusdrugs.com, sign up and get an account, see if your meds are on it. I got my doxycycline for $15. Now, do they have all the drugs you need? No. None of my inhalers are on it. But if you're looking at having to pay a very high copay for an antibiotic, check that first because that might be cheaper. Unfortunately, our friends at Blue Cross Blue Shield in Michigan do not participate with the Mark Cuban Drug Pharmacy yet. We can only hope that that happens. But please check that because that is an option. And when I go to the doctor, I don't know why this happens, but it does. You can probably imagine why it does. But when I'm sitting there and they're talking to me about my prescriptions, then I start hearing all the stories about other people in their practice who can't afford their prescriptions either. And is there something that you could possibly do? And I'm like, well, I'm retired, but okay. So I refer them to our friend Ron, or I refer them to the Mark Cuban Pharmacy, or I refer them anywhere that they can go because the cost of drugs is going to drive all of us into medical debt as well as all the high costs of pharmacy. So that's my story. Thank you for listening. It's not an easy road. It's an embarrassing road. And, you know, what else are you going to do? You got to have your medicine. So that's it.
So my story is, it started when I was a child. I have a personal story, and then I just remember as a kid, my mom was diagnosed with Crohn's disease when she was in her 20s, and she has struggled with it her entire life. Well, when I was a kid, she got very, very sick twice. And so as a kid, I just remember the bills being stuck on our bulletin board. Every month the bill would come in, and they would stick it on the bulletin board. Now, back then, they were able to just pay what they could, and the hospital just kept sending the adjusted bill. So fast forward, I had my daughter just over 4 years ago, and we were in the hospital a very long time, like almost a week, and those bills started coming in, and they were from everybody. I didn't get one bill. I got a bill from the anesthesiologist, and then I got a bill from the radiologist, and I got a bill from everybody sent something else. And so then you would call, you'd negotiate, they'd give you percentage off. And then we were able to pay it because we had saved money through our HSA for years. My husband's company was able to provide us with funds that were just deposited in there, and we were able to pay all of that without questioning anything. Because we didn't know. We didn't know you could call and question it. You didn't know that you could call and say, I need an itemized list here, and I need you to make sure these codes are correct. So we paid it. Life went on. So fast forward, last year, actually a year ago on Monday, I gave birth to my son, and he wound up in the NICU for 4 or 5 days. So we wound up with an emergency medical transport to Grand Rapids. They discharged me from the hospital, sent me to Grand Rapids to be with them. Everything seemed fine. They kept telling us, we're going to send you to St. Mary's because they're in your network. And so my husband and I were stressed and distraught, so we said, whatever you need to do, just do whatever you got to do. So we spent all this time in the NICU. A few months later, we started to get these medical bills that came in, and we didn't think anything of it. We were waiting for them all to come in for both myself and my son Theodore, because in the meantime, we did not get him on the insurance. If you wind up having a child, you can call early and get them on the insurance. So do that. Do that before your due date. So we had to navigate through that with getting him on the insurance and then contacting the hospital and saying, okay, now we need you to rebill this because now he's on the insurance. So months had gone by, we'd gotten these bills. They had said, just ignore them because you're going to get new ones. So we waited. We got the new bills, and we thought, well, something just isn't right. So then we wound up getting these bills from these debt collectors, and we said, well, wait a minute, we just got this figured out. Why are we in collections already? He's only 6 months old. Why is he in collections already? And so we wound up calling the hospital back, and we wound up going through all of our insurance paperwork and taking all 3 of the bills, the copy that the insurance company had, the copy that the hospital had sent us, and the copy that the collectors had sent us. And it turns out they billed us out of network for multiple services that had happened, and it had gone all the way back to my OB appointments prior to birth. And so they charged me $2,200 for one of my last OB appointments. And I thought, that's not right. So they had to go back through and rebill all of that. And so now we're a year later, and they are still working it out with the insurance company. We do not currently have resolution, so we are waiting for our insurance company to contact us and say, they actually just met last week to try to rework out that bill. They charged the emergency transport out of network, they charged my delivering doctor out of network, and they charged 2 of my OB appointments out of network, and I can tell you that I went to an in-network facility. I don't understand how that happens, but it does. So my advice to people would be get those itemized reports from your bills. And you need to call and sit down with a counselor and say, are you sure all of this is right? Spend the time on the phone with your insurance company and say, give me advice on what to tell them. Like, what code can they use that's the same thing that will reduce my cost? We also learned that both of my children are allergic to peanuts. And so every year, or sometimes every 6 months, we have to make sure that their injectors are up to date, and we have to have one for the house, we have to have one for the school, and we have to have one for the daycare. And those run between $400 and $600 a piece. Mm-hmm. So yeah, it's strenuous, and I'm really happy to, I'm gonna check out the Mark Cuban because I'm a huge Mark Cuban fan. I don't know why, he just speaks to me, but I am definitely, I don't know why I did not know that, but I will check that, so. Yeah, so just make sure that you do your due diligence. It's definitely worth your time.
So, you're not done. I get more questions. But they're okay questions. So, as you were talking about, I think you both described really that structural, that systemic barriers that you faced, right? And that you're stuck in a process that isn't working. And yet, as we've, heard from our partners and heard from some of the presenters today, there's really good people in the program and really good people within the process working to change it, but we're not there yet, right? So if you, and this actually is maybe an impossible question, like there's not a right answer. I have no way to fact check this, but just a gut check. Like when you think of, and if you want to just pick one example, or you can look at it holistically, but how much time do you think you spent trying to navigate that? Because, right, like,
Just hours, I guess.
like 10?
Days? I don't,
I mean, way more than 10, right.
I don't know.
It could be months by the time you add it all up, yeah.
A lot of time.
Right, and you're doing that with 2 young kids who are very
And a
time
full-time
kids and a
job.
full-time job, running a business, right? And you're doing that with 4 jobs between 2 people
Yes,
and 2 babies.
yes. Sick babies. We're sick all the time.
And you think about the resources that it takes to be able to do that based on time, right? And you think about the skill set and also the confidence that it takes to say, you know what, I think this is wrong, right? Because I, like you, I mean, it was a long time in life before it occurred to me that you could call up and say a bill was wrong. So when you think, either looking at yourself or looking at others, and I know it's not conversations, as we've said, that we often have, but what do you think some of that impact on lives and some of those trade-offs that people have to make as they're navigating this?
I think that it's tough because it's isolating. People, they don't want to talk about the debt. And I think what that does is it really limits their resources because part of my job is to network. And so I'm a Rotary member, at the Chamber member, I do all of these network events. You never know who you're going to meet and what kind of conversation you're going to have and how they can help you. And so if we're not sharing our stories, not like a woe is me story, but just, hey, I'm going to be part of this forum, or, I know these people, talk hypothetically, and people don't talk about it, and you don't know who's going to be sitting next to you that has that one piece of information that could help you. So I think that reducing that stigma, and I work in mental health, so I'm all about reducing stigma for whatever you got going on. You do you, let's reduce the stigma, stop judging people, like, world would be better. So I think that if we just had that mentality that we all have something that is stigmatized, like, let it go, because it will benefit you, and it could benefit you thousands and thousands of dollars in this case.
Well, and I think part of the advantage that I had is that I had worked in the healthcare system, so I had an idea of what to do, which is why, I was telling Liz, and poor Ron isn't here, but, now I'm doing Medicare counseling, even, except when it gets hard, then I send it on. But when I'm talking to people, it's because this is just like speaking Klingon to most people. I mean, it is, I don't know how else to say that. People don't understand the bills. There's also literacy issues involved. And then when you start getting literacy issues and income issues, then you get all these other barriers that are through. I mean, when my daughter needed services, there was no one in this county that provided them. But what I was able to do was I was able to call my alma mater, because I knew they had a program to get an intern up here in order to go sit at the school with my daughter until they could do that. I had that ability to do that, but there's a lot of people that don't have that, which is why it is important for us who know how to do some of those things to offer our services to people, because I often think to myself, I don't know what I would have done if we hadn't been able to kind of connect with people and figure things out. And the irony of all of this is that the medical treatment that my kids, especially my daughter, got are now the standard of care. They were, 30 years ago, they were experimental and hence not approved. I offered to put them into medical programs because as a child, I was always very ill and spent my life at U of M Hospital in experimental programs all the time for medical care because that's how my parents got mine. But I couldn't get my kids in that. So, you know, it's just that issue. We need to talk about it. We need to be at forums. We need to be at churches. We need to be wherever they are and not let people give up because nobody wants to help you. Let's be real here. Nobody on the end where you're paying your bills really gives a damn because their job, and that's the other thing you have to understand, their job is contingent on how much they get from you. And they've got a family to support. So it's this circle that goes all the way around. And that's why we have to do this. Because if we don't, there's going to be people that are just stuck. And both of us were fortunate because we're persistent.
Thank you. That was, you guys are incredible. You make my job very easy. So one last question. If you could challenge this group, who's community members and folks working from community partners working to provide access, reduce impact, share resources, what's something that everybody in this group could do or that you wish that they would do, you know, that could help impact it? It can be a big thing or a small thing.
I would just say if you or someone you know tells you that they went into the hospital or they're having surgery or whatever, don't just send them a get well soon card. Ask them the question, did you speak to the finance office? Did you check your bill?
And I would say the same thing, and then I would ask them, how are you getting your medications? And if you have some odd disease or maybe not so odd disease, can you get in a clinical trial where someone will pay for it? Because trust me, they want people in clinical trials.
It's incredible. Thank you both so much.
Kristen Turgeon is with Mission for Area People, and you are the new executive director. I mean, how many months have you been on this now?
Just since the beginning of January.
So it's new.
It's brand new.
Brand new, but you've been there for a while, and you know really a lot of great things about Mission for Area People. One of the agencies here in town where people can actually look for some help into this kind of stuff. Talk about the work that you guys do at MAP.
Okay. We have a lot of different services at Mission for Area People.
It's just me. You don't have to be nervous. It's all good. Take a deep breath.
And, one of our main services is our medical fund. So with the medical fund, we help with not just medications, but we help with gas cards to get to medical appointments, co-pays, durable medical equipment with a prescription. A lot of people miss their appointments to their doctor just because they can't afford to get there. So that's one of our major requests with our medical fund. But we also have funds to help with financial assistance for daycare to keep people working. We have rent and utility assistance when available. We do healthy cooking on a budget classes and many other services as well.
You've got the healthy food pantry there that people can come by, and you've
Yep.
got the closet for clothing and all that kind of good stuff. The nice thing I like about Mission for Area People is that, you know, I grew up in Catholic schools, right? So we're all taught that charity is to be kept quiet and small. And I don't think you can get much quieter and smaller than the basement of a church where you guys operate out of. Talk about the space and how you guys put that to work.
Okay, we do have an interesting space. We are located in a church right across from the Heights High School. And our pantries, we have our Healthy Choice Food Pantry is pretty large. It's one of the largest pantries. I think it is the largest in Muskegon County, but it's downstairs. And then we have a free clothing pantry on Tuesdays and Thursdays that's upstairs. And so we are currently doing renovations so it's more accessible. And it's ramp access to the basement part of the building. It's going to be really pretty, and we will be having an open house end of March. So follow us on Facebook.
Absolutely. I love the work you guys do, and you know that because anytime she calls, I come running instantly to be a part of the work going on at Mission Ferry People. Kristen, thank you for all you do. Anything you want to leave us with Mission Ferry People?
Well,
The open house in March.
yes, we do have our open house in March, so that'll be all online on our website and on our Facebook page. And also, we are currently working with the Nelson Place seniors, so if anybody would like to donate to the cause, we're the only agency collecting donations for that, and the seniors need a lot of help right now.
They really do after the flood and all that stuff. Thank you for the great work that you do, Kristen. Step right on up here, Miss Sherwood. Nope.
We're over here.
Oh, over here. I don't know these two. We're going to get to Sherwood in a second. Step right on over here. You two have been in the front row the whole time. What did you think
Yeah,
this was, a concert or
We're
something?
good listeners.
You are?
We are. We've been paying
No,
attention.
you are.
I speak for both of us.
I get that, right? But you are.
Oh, sorry. We are with Volunteer for Dental.
And your teeth look very nice and white.
Oh, good.
Are you hygienists? What do you do?
We are local hygienists with the Grand Rapids Community College.
Really? I went there for like 3 weeks.
Yeah.
Doesn't it show? My mom was so proud. She gave me just enough tokens to make it 3 weeks, and then she figured I wasn't going to go anymore.
Oh,
She
yeah,
was right. Talk about your career. What got you into it?
Yeah, so we are very passionate about oral health, and Volunteer for Dental is an awesome organization that offers no-cost dental care in exchange for volunteer service. So it's a pay-it-forward program where community members in the Muskegon County can accrue community service hours and use those hours to pay for dental services. So those services could include x-rays or tooth extractions or restorations for cavities, things like that. So it's an awesome opportunity in the realm of avoiding dental debt or medical debt, because you can get your hours accrued and you don't have to pay any amount of money to have your work done. And we know as hygienists that dental work is very expensive. So it's a great opportunity.
What got you into the career? What was the idea behind you picking that? Because, there's careers out there. Digging around in somebody else's mouth is not really my idea of a career.
Yeah, I just, I love a beautiful smile.
That's
so
it. How about you?
Yeah, I wanted to be a dentist at first. I bailed on that, and so here we are for dental hygiene.
Wasn't there a Christmas cartoon that a kid wanted to be a dentist at one point, I think? I'm too old, ain't
yeah,
I?
you might be a little
I'm really
older.
old for that. Volunteer for Dental is really one of the outstanding organizations in our community. You guys come over from Grand Rapids Community College.
Yeah.
Is there anything like this over there?
Not that we're aware of. This is really unique to the Muskegon area.
Yeah.
Yeah, go Muskegon. I love it. So, yeah, get out there. What we would recommend, it's a really easy process. So just either go to the website, volunteerdental.org, or call the office, and they can run you through a really quick screening process to see if you qualify. And then they'll get you started with over 30 volunteer opportunities in the Muskegon area. And then they partner with over 20 local dentists to get the work done. So it's a big program, and it's something that's awesome for this community.
My dentist is in on that program,
Oh,
which I
awesome.
love, which
Yeah.
is really a great thing. So you guys are awesome. Do you have a dental office you work in now?
No,
You don't?
We are
No.
working towards it.
On your way toward it?
Yes.
Right.
7 weeks of school.
7 weeks left.
We're almost there.
And they're on their way. Give them a nice round of applause for being here from Grand Rapids
Thank you.
today. Thank you guys so very much. And are we bringing him in from this direction again? Health Project. I've heard of this before. Welcome. You are?
Hi, I'm Caitlin Hermanson. I'm with the Health Project.
Nice to meet you, Caitlin Hermanson. Thank you for being here today. We've heard a lot about the Health Project. We've heard a lot about the work that goes on. A lot of people might not know about it. We're going to hear more about it from
Mr. Michael Ramsey.
Yeah, that guy that steals most of the gigs I get anymore. But tell us about the health project before we turn this one loose.
Yeah, so you guys have heard a lot of it already today, but any enrollment services you need, if you're looking for a provider, if you're looking for access to medication, if you're looking for a service to help you pay any bills that you might have, call us. We've got you covered. We are the Community Health and Wellbeing Department at Trinity Health Muskegon. So in addition to our awesome CHW team, we do a lot of prevention work in the community. We're taking over management of McLaughlin Groves Urban Farm. Lots of really cool stuff happening. So yeah, awesome. Excited to be a part of it.
I love it. Great. I think we're going to reset the stage for that tornado we just talked about named Michael Ramsey, who will be next from the stage here at the Van Dyke Mortgage Center. Stand by.
Good Thursday afternoon, everyone. My name is Michael Ramsey, and I want to thank you for coming to my party. I have the distinct pleasure today of talking to you about another way to mitigate the costs associated with healthcare, and not only healthcare, but some social care as well. We know that when you have a ton of bills coming in, that you're looking for any relief that you can possibly get. And so Trinity Health Michigan has put together an online, electronically sourced community resource directory. And the best part about this site is that Trinity has two versions of it. One of them is for our doctors, medical staff, and community health workers, and the other is for all of you. And what that means is that the information that's available to you is also available to us. So anytime you walk into one of our offices, no matter which one or where it is, whether you're serving your brain or your body, there's an opportunity for you to have conversations with your medical providers about things that you might need that happen outside of those four walls. Right? So anytime that we can save money so that we can pay some of that medical debt down after we've applied for patient assistance through the hospital, and we've done all of our enrollment services at the Health Project, and we've been over and seen Kristen, and we've talked to the girls about teeth, and we've done all young women about teeth. Are they in here? Yeah, no, they are. You know, my colleague Ron said that don't worry about it, don't put it off. Well, let's pretend you're worrying about it and it's 3 a.m. in the morning. This is where you visit. It is the communityresources.trinityhealth.org, and it really is quite simple to navigate. Miranda, I want to thank you for going back to this front screen. So if you pull it up on the internet, this is what it looks like. And you'll see that there are two options. One of them is optional, but the second one is available in. Miranda, can you type in 49441? So the way that the CRD, the Community Resource Directory, is set up is geographically. So let's pretend that I live in a specific part of the city and that transportation is an issue for me. Well, it would be terrible if they gave me a resource in Norton Shores that I couldn't get to. So we make sure that as we connect people to information that might be able to help them, it's so that they can access it, which is always helpful because we know that in Muskegon County, transportation is a huge deal. Talk to your county commissioners. Use your vote. You'll also see that this is it's pretty easy to navigate. It really is set up almost like a social media platform. There's an opportunity for you to sign up for an account and to log in. The best opportunity there is that if you are looking for resources, you can save them so that you can go back and visit them at any time. It's also a great place to kind of track where you've been and what you've done. So for those of you who are actually in social care, we have a great opportunity with you through Trinity for me to come and teach your entire staff how to use this, and it then acts also as a online repository for any people that you've been serving. It's completely HIPAA and FERPA compliant, and nobody gets in trouble. So we're gonna do something very, very easy. Okay, we're gonna go to food. Yep, we're just gonna click on community gardens right below it. There we go. So you'll see here that we have a list of community gardens available in Muskegon. Now, the best thing about this is that every single resource within the Community Resource Directory is either free, reduced cost, or on a sliding fee scale. So no one is in here that's paid a bunch of money to get an ad to pop up. In fact, you won't ever see any ads pop up. The one thing you will see is a wonderful feature that I designed alongside 211 that if you say that you need help, a little button will pop, they're called flyouts, will pop up and say, hey, you need help with this resource. If you want to talk to someone on the telephone about it, click here, and then you're immediately connected to 211. Because we know that in our community, 211 is best at resource connection. And so we as the hospital wanted to lean in and support that. So it's a great opportunity for us. You'll see here that with this card specifically, the Operation Healthy Heights, this happens to be one of the projects that is funded by Trinity Health Muskegon through our Community Impact Grants program. And there's a couple things I want to call out about this, what's called a program card. You'll see over in the right-hand corner there's a little check mark. That means that someone at Operation Healthy Heights knows that this is there. This information is current and up to date and is guaranteed to have a response. So some cards don't have that, and all that means is that we're still working through all of the kinks on their end to make sure that they know someone's there and that they have the capacity as an organization to take on this work. My job is to help build that capacity, should they ask, and to help them through the process so that, again, this information is at the fingertips of not only our community, but our clinical partners. So that if you are to come in, Adam, and answer a social influencers of health screening tool, and you identify any needs that you might have, they can connect you to them right at your doctor's office. It's an amazing thing. So, Miranda, could you do me a favor? Click on Operation Healthy Heights. So this program card expands, and as Miranda kind of scrolls down, you'll see that there's a lot of information about what's being offered through this program and ways to contact them, several ways, in fact, which is an amazing opportunity. Some of those buttons, right there it says available contact. That's what they call in the business an action button. I did not know that because I'm not in the business. But there's also an opportunity where it might say refer or get more information or talk to someone. And so it continues to share with you the what, the when, the where, and the why of this agency itself, which is an amazing opportunity. Now let's pretend, could you go down a little bit further, Miranda? So you'll see here that there's a button that says suggest change. So let's pretend that you are already in cahoots with Operation Healthy Food, or whatever this is called, Healthy Heights, and you see that something on this website is wrong. You can make a suggestion to the team at Find Help, which is the platform that the CRD, Community Resource Directory, lives on, and they will check with the agency and update it if it's wrong. Isn't that awesome? So you're helping your neighbors get correct information as well. There's also an opportunity for you to sign up and log in. So if you had signed up for an account, which you all should because it's free, you could save this information, regardless of whether you're a social care provider, a clinical colleague, or just a neighbor who wants to get some good stuff out of our wonderful city. There are so many resources in this town. You guys should all be welcome to use them, and there is no stigma attached. I know that it's not as easy as just reducing stigma, but how we reduce stigma is by using what is available to everyone to show that it's for everyone. Miranda, could you go ahead and go back up to the top? Awesome, thank you so much. Now you'll see right there that there's a button that says save and or share. Miranda, go ahead and click on share. Or save. No, it's okay, we'll do, okay, or share. Just commit to one of them, sis. All right, so Miranda, scroll down a little bit. Now you'll see that you can tell someone about this program. So let's pretend that I know Adam is looking for Operation Healthy Heights because he wants to increase his intake of fresh and nutritional fruits and veggies. I can send this information to Adam in an email or in a text message, and it comes up completely readable on his phone, and all he has to do is click it. Or I can send this to myself. Because if I have to go from my house to wherever this is, once I get there, if I've forgotten what's going on, my name is Michael Ramsey, I always forget what's going on. I don't know if you guys experienced the AT&T outage this morning, but I had to whip out a map to get to Hart, Michigan. That's a real story. Anyway, that's for another time. So you can share this information at will with anyone that you think might need it. There's also a share on Facebook option, which is odd to me, but let's pretend you're doing an event like this. And the MedDet team said, hey, Michael, we want to feature all of the community, or all of the social care providers are going to be at our event. How can we do that on social media? MedDet could have started an account, went on and shared all of these things on Facebook and said, hey guys, come see Volunteer for Dental at Transformation America building of the teardrop sculpture of the Convention Center of Muskegon County, right? And it would have been amazing. So you can also send a message. Now, if you could do me a favor, Miranda, and roll down a little bit, there's something super cool about this. Click on that place that says English. There are 117 languages stored in this system, and it translates everything automatically. So let's pretend that Adam, his first language is Spanish, and he does pretty good in English, but he's way more comfortable in Spanish. I can send this information to Adam in English, and he can respond to it in Spanish. I can send it to him in Spanish. He can respond to it, but I will receive everything in English. So while this does not take the place of language interpretive services at any provider, it really does help, because it really does allow us to meet those that we serve, or our neighbors, or our friends and loved ones at a more intimate level. 117 languages. That's super cool. All right, Miranda, now do you want to go up and click the other button that we sort of played with for a second but then decided not to commit to? Awesome. So the Save button, if you have a login created, go ahead and click it. Oh, it's Thursday, it's tired. There we go. Okay. So typically when you click that Save button, it gives you an opportunity to save into a folder that you've created or to create a new folder to save it into. Now, because we don't have a login, and my login is the clinical side, we don't want to do that because it looks a little bit different. You can save this and share it or re-access it at any time. Miranda, could you do me a favor and click on the Coalition for Community Development CCD line? Up. Right there. Awesome. Thank you so much. So, Miranda, if you want to scroll down, so you'll see that there's only one program that shows up for the Coalition for Community Development. But if they had more than one program, this is known as their provider card. So all of the programs that were housed out of that agency would show up on individual cards. And you could contact that way or see what else they do. For instance, MAP. MAP has several on theirs that really do outline all of the programs that they offer out of their building, which is an amazing opportunity because if you know that you have friends at MAP and we know that our neighbors enjoy the relationships that we get to build with them, that's how we get to serve them better is by getting to know them. Then if I know that I have a great relationship with Kristen and she's doing other things out of her building that I need, I know that I can go to her and ask her. So that's an awesome opportunity. Before I move on, are there any questions about what I've covered thus far? I didn't think there would be. It's pretty straightforward. So again, I'm going to reiterate that these services are free to anyone who accesses. And if you are a social care provider in the room and you are not already logged onto this system, please reach out to me because you being a part of this system is also free. Trinity Health Michigan picks up the bill for that so that we can make sure that your information is current and correct so that we can make real and relevant resource referrals, bam, to all of our neighbors at any access point. Yes, ma'am. Questions, please.
Would the login be for somebody, like I'm a case manager, would the login for me be different than like a community member if I was somebody who was doing referral for somebody, or would it be
So,
the same?
wonderful. Wonderful question for a social care provider. So what we would do on a social care provider aspect is we would come in and create an account for your agency, and then you and anyone in your office could be a part of that team. Air quotes. And you guys could share information while you track who and how you serve on the back end. Another great opportunity for social care providers is that I'm able to collect a ton of data based on who from where accesses when and what. So if you're putting in for grants or you're looking at how to expand your customer base or how to better reach those that maybe you're not quite getting to, we can review and interpret that data so that you have an opportunity to use it to the best of your ability. But for a neighbor, it's just create a login and hit it to win it. Are there any other questions that I can answer? Yes?
Are you able, you talked about having a lot of data, so are you thinking about how you're tracking trends in terms of who's using what and where we need to grow or improve or reduce stigma so people do access X or Y?
Yes. So we call that the social vulnerability index, and there is an actual report that I run for that quite regularly. To the point that I can run that report for each and every one of our individual ambulatory care sites, which is your doctor's office or your esthetician's office or your dental office, should they be attached, so that I can figure out exactly who is coming in those doors and what they're asking for when they get there. Because wouldn't it be awesome if you ran a doctor's office and you knew that the top 3 needs that come into your door are dental, transportation, and food? I could come in and educate your staff about those 3 things specifically, even though we have this great opportunity, so that when someone says something, it falls right off their tongue to connect our neighbors. Aren't I wonderful? Wow. I can't take credit for any of it, but so I encourage you guys to please reach out to me, michael.ramsey@trinity-health.org. I'd love to chat about it, and if any of our neighbors have any questions, you can get to us through the Health Project. All you gotta do is ask for Michael, and they'll send me an email, and then I'll reach out to you. But thank you guys so much for having me today.
It is so good to see you again. Dee is with our Muskegon County Department of Veterans Affairs. Are you going to talk today, or am I going to have to pull this all out of you? You're going to talk today. Yeah. Talk about the work that you guys do. It's really a lot more than most county veteran facilities do. Talk about the work you do at the Muskegon County Department of Veterans.
Okay.
Muskegon County Department of Veterans Affairs job basically is to ensure that our Muskegon County veterans and their dependents are connected to their benefits. A lot of veterans don't know about the benefits that they may be eligible for. We have 5 accredited service officers at our office. We start with, are they enrolled in health care? And then we see if there's a service connection disability that they may be eligible for. We also have emergency assistance programs through grants that we apply for. So whether you're a war era veteran or a peacetime era veteran, there are grants that are there to help you financially. We have a food pantry, so if a veteran or their dependents are in need of food assistance, then we help them with food or other resources between the state and the federal.
There's a lot of great work that goes on, and you also do the big stand down that helps these veterans out remarkably. Talk about that event and what you see through that day.
Well, Andy, I'm glad that you brought that up. So the stand down this year will be September 18th, 11 to 3 at the Barclay Center. The address is 2330 Barclay Street, and at that resource event, we have a jobs fair. It's like a 3-in-1. Employers are there. We have community resources. We have several speakers that are there to give knowledge to the veterans and their dependents and civilians about different things that are happening in the community. So yeah, it's a huge event, and this year, again, it's September 18th.
Looking forward to that. I was there last year before it all got kicked off in the boots that they had for the guys. I'm like, I want to be a veteran, but no, I didn't get a pair of boots. You did a great job. Look how you've come out of your shell. Look at you. Give her a nice round of applause, Dee. So good to see you again. Sarah, are you next? The United Way, by any definition in any community, is the resource where it all kind of focuses. And it is such a big honor to have you guys here in Muskegon doing the work you do. 100 years plus. Talk about the work of the United Way.
Yeah, we're really a community convener, so we like to bring our community and all of its resources together to create a greater impact. And we do that through working with nonprofits, several of which are here today, so that's really exciting to see, and our community members and working families.
You've got programs, too, that reach out so much further than just what people would assume. You've got the Dolly Parton Reading Library. You've got all these different things that go on. Talk about that impact and how it reaches out further than most people think.
Yeah, we cover the Dolly Parton Imagination Library here in Muskegon and Oceana counties, so all kids between the ages of 0 and 5 are eligible to receive a free monthly book from Dolly Parton and United Way. In addition to Dolly Parton, I really want to talk about our single care program, which is a program I don't get to talk about very often, but since we're talking about medical debt, I want to talk about this free prescription savings program that is available to everybody in Muskegon, Oceana, and Newaygo counties. Last year, in 2023 alone, Muskegon County residents saved over $300,000.
Wow.
So it's a free program. I have information over on my table. I also have it online at unitedwaylakeshore.org. It's a completely free program where you can download a card right online, take it to your pharmacy, and you can use it with or without insurance.
Love that. That's great stuff. Any final words about the United Way?
If you're looking for community resources, make sure you call 211.
We love that, too. We were down there. And you know what? We put them on this year as one of our givebacks for what we published, the Muskegon channel. They are on with us all year as a resource for anybody to come. So if you're watching on us today with the Muskegon channel, know this. This seminar is going to be available to watch forever. So, you know, and United Way is one of our great sponsors, too. That 211 number, you'll find that there. You'll also find this. We're going to edit it up a little bit. but this will be online for you to watch on demand at muskegonchannel.com, as well as, I think we might put it on Channel 96 too. We got a little TV channel here in town. So from all of us here on this reduction of medical debt forum, thank you for tuning in today. Thank you to Access Health for putting this all together. Trinity Health, let's give them a nice round of applause for supporting our web stream today and the broadcast of this all. And for everybody that helped pull this off today, I want you to remember one thing finally. One of the things we talked about here was that humiliation of medical debt. Let's get over that, because it can happen to anyone, anytime. We've heard stories today of people that have adopted kids and found themselves $300,000 in medical debt just like that. That's not ill intent. That's not bad behavior. That's just trying to get things taken care of that need to be taken care of. Remember that. We've also learned today, too, that we have a communications issue. It's hard for us to get the word out about all these programs. So if you see something here today that rang a bell with you and you thought, boy, I didn't know about that, look into those resources. Learn more about what Michael talked about a couple of minutes ago. Call 211. Look online. Follow this, when we get the video up again, watch it again, share it with friends, and help us all work toward a better Muskegon over the future, because that's what this is all about. You want to give them the final goodbye?
Thanks for coming, everyone.
Look at her. She wrapped it up perfect right here on the Muskegon channel. Thanks for watching, everybody.